everyone. I'm happy to see so many of us back this afternoon for the second Sabbath of our 4-week series of presentations on health-related issues. Today, I'm going to kind of recap. Last week we had Dr. Cad speaking about diabetes in adults and children. Today we've got Dr. Amen, 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 amen. It was depression. Thank you for that reminder. Today we have Dr. Anele. The good thing about him is that he's almost like a resident physician, because I run a football team on a Sunday, and he's there to give us the old if that's needed. Also bandage aches and pains and cuts and bruises that may occur during any given match. So I'm privileged to have him as a part of our team, but also it's a privilege to have him here today, because not often that we have speakers of that nature presenting to us as a people. And we speak so highly about health, but also from in our quarter, that's where it sits. But now we've got someone who's, yes, he does believe in God, but he's not a part of the Seventh-day Adventist Fellowship, but he's willing to come and speak to us about something that we resonate with, which is health, and specifically diabetes. I don't even know if I've got it. I don't even test myself that often, if at all. And it's good to know the ins and outs in terms of what it is, what the signs you need to look for, and possibly, and I guess more importantly, the treatment for diabetes. So Dr. Anele is going to come forward with a smile, and he hasn't got his necktie on, so don't worry about that. He's going to do his thing. Thank you very much, Doc. Thank you. But before he speaks, I'll ask Brother Dan to come forward to offer a word of prayer.
We are so grateful, dear Heavenly Father, for this beautiful day and sunny day. We are grateful that we can walk, that we are healthy, that we could come in this building, in this church, and it's still open, and we don't have tribulation and problems. Help us, dear Father, to understand the word that you will present us through this brother. Help us to understand, to memorize it, and to practice it. In Jesus' name I prayed. Amen.
Good afternoon, everyone. Thank you for having me. My name is Dr. Anele. Today I'm going to be talking about diabetes. I'm just going to wait for the... perfect. Okay. Can everyone see that okay? Perfect. Right, so let's see if this works. Sorry? Oh, Dr. Anele. I'm Tony Anele. Anele, A-N-E-L-E. Got that. Oh, yes, there is. Oh, yeah, perfect. I'm just going to see if this works. Oh, perfect. Gotcha. Right. So we're going to cover a few topics, of a few subtopics. The first thing is what diabetes actually is. I'm sure some of you might have a bit of an idea, but we'll explore that in a bit more detail. Was it the height? Yeah. Thank you. Cheers. I appreciate that. After that, we'll explore what causes diabetes, and then we'll go on to talk about the symptoms of diabetes as well. Following up from that, we'll talk about some of the complications that can arise when someone has diabetes. Is it that? Perfect. Thank you. Cheers. Perfect. Thank you. I appreciate it. And most importantly, we'll explore how to identify it and how to actually manage and treat diabetes. And then we could do like a Q&A afterwards if we want. Okay? Sweet. So what is diabetes? So to summarize, diabetes, or the long name is diabetes mellitus, it's a disease characterized by a chronic, abnormally high level of blood sugar. And essentially you can have different types. You can have type 1 diabetes. You can have type 2. Those are the two main ones. You can have some other ones as well, such as gestational diabetes, which occurs in pregnancy. and there are other few more niche ones as well, but we won't explore those ones. There is another type called diabetes insipidus, but we're not going to talk about that. It's a different disease, and it can present similarly in terms of symptoms, but it's a completely different condition, so I won't ramble on about that one. Right, so the important thing about diabetes is that it's quite common. So I think back in 2000, the prevalence was about 4.6% globally. That's now increased to about 10.5% in 2020, and that's still climbing. So it's quite a common condition, and it's important that we're aware of it so we can deal with it effectively. In this presentation, the main type I'm going to be talking about is type 2 diabetes, and I'll explain why as we progress through the presentation. But essentially, most cases are type 2 diabetes, about 90%. Right, so what actually causes diabetes? So, just to get down to the basics, I'm sure you're aware of your dietary intake. Carbohydrates essentially make up a large portion of our diet. It includes things like sugar, like simple sugars, and also carbohydrates like your starchy foods, pastas, bread, etc., etc. There is a hormone called insulin. I'm not sure if you guys have heard that before. Essentially, this is made by an organ called the pancreas, which is somewhere in our bellies. When we eat carbohydrates, our blood sugar levels increase. Now, in response to that, the body senses that increase in the blood sugar and tells the pancreas to release insulin into the blood. Specialized cells called beta cells, you don't have to remember it, it's not an exam, but if you want to know the sort of minutiae, the beta cells are responsible for creating the insulin and releasing it into the blood. Essentially, why insulin is so important is that it allows the cells in the body to bring sugar into the cells. So what it does, it acts like a key to move the sugar from the blood into your cells in the body. And this has an effect of allowing your cells to use the energy in sugar, but also brings down the glucose levels in the blood, or the sugar levels in the blood, to normal levels. Okay? Any questions so far? Okay, we'll proceed. We'll have a Q&A at the end as well, so if you have any other burning questions, just shout them at the end. Right, so exploring the different types of diabetes. In type 1 diabetes, it's separate from type 2 in the sense that the beta cells in the pancreas get destroyed, and this is usually it's what's called an autoimmune disease, where the immune system, the cells that sort of fight off infections, they accidentally identify the beta cells in the pancreas as a harmful threat, and that leads to their destruction. So what happens is that the pancreas can no longer create insulin, and your blood sugar levels remain very high. So your cells don't get in as much glucose or as much sugar, and your sugar levels remain quite high. So that's type 1 diabetes. Type 2, before we move on, for type 1 diabetes, usually it affects people that are below the age of 20, so it's usually children or teenagers. Usually it's diagnosed with, between people that are between the ages of 10 and 14. And the symptoms come on quite quickly, within about days or weeks. And we'll talk more about the symptoms later on, but compared to type 2, it's a faster onset, essentially, with the symptoms. Now, for type 2 diabetes, the pancreas is still creating insulin. However, there's a problem elsewhere. So, essentially, remember when I said that the insulin acts on your cells in the body to allow sugar to enter the cells? So, with type 2 diabetes, the sensitivity of the cells to insulin decreases. So, essentially, the insulin has a reduced effect on your cells, so less sugar can enter your cells. It's like, imagine you have a key for a lock, but the key becomes faulty. So it works sometimes, but not all the time. That's sort of how type 2 diabetes works. So what happens is you need more insulin to bring in the same amount of sugar into your cells. Eventually, as you get more decreased sensitivity, the compensation of increased insulin stops having an effect. So the body's unable to compensate for that decreased sensitivity, and that leads to an increase in your sugar levels in the blood. So it's a bit more complicated than type 1, but the same thing results where you have what's called a greater amount of sugar in the blood. Another additional mechanism is that as your pancreas is trying to increase the amount of insulin to compensate for the decreased sensitivity, it tires out those specialist cells, so the beta cells, and those eventually become damaged. And that also compounds on this mismatch with the decreased sensitivity and the amount of insulin that's required to get the sugar into your blood, from the blood into your cells. Very complicated stuff. But, oh, sorry, go for it. Sorry?
Diabetic too, it's reversible. We can get rid of it. If we have diabetic too, we can get rid of it by eating the right things and drinking a lot of water.
Yes.
Because I know somebody who had it and they reverse it.
Yeah.
And the doctor and couple nurses was talking to him about it. How did he reverse it? And he did.
No, you are correct. So like, unlike type 1 diabetes, where it's usually irreversible, with type 2 you can reverse it. So you mentioned things like diet and exercise. Yes, those are things you can do to reverse diabetes. And we'll get onto that later on. So I'm glad you brought that up. Any other questions? Yeah. Okay. Oh, sorry. Did someone say yes or?
My sister. Pass it.
Yes, Doc. You mentioned diabetes started at the age of 20.
Yes. So that's for type 1 diabetes. Usually, it gets diagnosed in children and teenagers. So below the age of 20, that's when you usually pick up people that have type 1 diabetes. With type 2 diabetes, it's different. So the onset is usually in middle age. So above 40, that's when you start seeing people that develop type 2 diabetes.
Okay, thank you.
That's all right.
What I'm saying is, I know a 10-year-old boy is a disabled child.
Yeah.
And he started wetting himself from at least about 2 months ago.
Yeah.
And when the lady took him to the doctor, he said he's suffering diabetes. Up to this morning, he wet himself several times. He's just 10 years old. I think the diabetes attack people even younger.
Yeah. So that's most likely to be type 1 diabetes. Oh. And you mentioned one symptom that's quite important. So you mentioned he was weeing quite a lot. That's one of the key symptoms that you can get with diabetes, but we'll explore that in a bit more detail later on. But it's good that you pointed that out. Thank you. Oh. Anyone else? Oh, hi.
Yeah, thanks. The sensitivity of the cells that you said doesn't allow the sugar to go in, so it stays in the blood. So if the sugar doesn't go into the cells to create energy, does it just leave people in a sort of zombified, sleepy mode?
I think you do get some glucose or some sugar entering the cells, so people are still able to function, but it's not enough to the point that it brings down the blood sugar levels to a safe level. So you're not like, you're still able to sort of get some sugar in, but it's not as much as you would be required to like sort of be in a healthy state, if that makes sense. But that's a good question. Go for it.
Why is it so important to keep your blood sugar levels under control?
Good question. I would answer it now, but I'm going to park it because I'm going to address it in more detail later, but that's a good question. Sorry? Yes, you can. if it's well controlled. So if it's not well controlled, then I'll explain later on as well, you're more likely to get complications. But if it's well controlled, then generally speaking, yes. Anyway, I'm going to move on just because, but we'll have a Q&A later on, so don't worry. Right, let's see. Yes, so, it's kind of cut out a bit. Essentially, what that's showing over there, it's that, like I mentioned before, about 90% of diabetes is type 2 diabetes. I mentioned the sensitivity. So, when it comes to the sensitivity of the cells to insulin, there are different factors that affect that. Some of those factors you can't modify. That includes your age. So as you get older, sensitivity will naturally decrease. I mentioned sex as well. So in males, that is a non-modifiable factor. So if you're male, unfortunately, that's going to increase your likelihood of getting a decreased sensitivity. If you have people in the family that have diabetes, type 2 diabetes, that is another risk factor. So it usually means you have a genetic predisposition to develop the condition. And I've mentioned polycystic ovary syndrome as well. That's another risk factor, which might affect some women. Now, the ones that are in red are all modifiable factors, and those are the most important because that's what we can control. That's what we have the power to sort of help to avoid or decrease the likelihood of developing diabetes. That includes cutting down on obesity, improving diet, cutting down on smoking, decreasing your blood cholesterol, which is linked to diet as well, controlling your blood pressure, and reducing stress. Now, the stress one sounds like a funny factor, but it is a factor. So if you're continuously stressed, like for months or years, that will increase your likelihood of developing diabetes. And the reason why is that it leads to raised cortisol in the blood, and that has an effect of increasing your chances of developing type 2 diabetes. Whereas if you sort of manage your stress well, then that is a protective factor. Now, I've got another one that's in blue, and that's gestational diabetes. This is more towards women who might develop it during pregnancy. So if you've developed that during pregnancy, that's another risk factor to developing type 2 diabetes. But I won't dwell too much on that condition. It's just if that's something that gets picked up during the pregnancy, then just bear that in mind as well, okay? Right. I've brushed over those 2 points at the bottom. So like I mentioned before, modifiable risk factors are in red, and usually it develops when you're like in your 40s, 50s, 60s, etc. for type 2 diabetes. Okay, we'll move on. Yeah, this is a quick summary as well, comparing type 1 and type 2. So type 1, so the body doesn't make enough insulin. Usually the immune cells that fight infection target what's called the pancreas. Usually starts in childhood, and the symptoms come on quite quickly. Whereas with type 2, the body doesn't respond to the insulin because of the decreased sensitivity. It's usually down to things like lifestyle factors, genetics, etc. And it's more common in middle age, and the symptoms develop a lot more slowly. So usually weeks, months, maybe years. Okay? And then we'll talk about the treatment later on. Okay, so what are the symptoms? I think, who was it that mentioned some of the symptoms? Was it yourself? Yes. Someone mentioned like wean a lot, and that is one of the main symptoms of diabetes. So essentially, the symptoms overlap with type 1, type 2. With type 1, you're more likely to get the symptoms. So you're more likely to get things like increased thirst, so you'll be craving a lot of water. You will be peeing a lot more. With type 1 especially, you're more likely to get weight loss, okay? You can also get increased appetite and visual blurring. And those symptoms usually come about over days, maybe weeks, okay? With type 1 diabetes, there's something that people ought to be aware of as well. So if you know someone that has type 1 diabetes, they might be aware of this. Sometimes they develop a complication or serious condition linked to it called, fancy name is diabetic ketoacidosis. Essentially, it usually presents with vomiting, nausea, tummy pain, and they'll become dehydrated as well. And that's a serious condition that can develop. And usually they'll have to go to hospital for that. But that's usually linked to type 1 rather than type 2. So I won't dwell too much on that, okay? Right. So type 2 diabetes, it typically presents with no symptoms, which is problematic because in a lot of people, it can go undiagnosed. And like I'll mention later on, that's how people develop complications that they don't realize is linked to diabetes until it's a bit, I don't want to say it's too late, but until it's affected them. And ideally, we want to catch it before it affects people in any sort of capacity. But yes, you can still get the symptoms of increased thirst, increased urination, visual blurring, increased appetite. Less so with type 2 diabetes, but you can also get weight loss in a few individuals, but it's not as common as, say, in type 1 diabetes. And like I mentioned, the onset is a bit more insidious. So it's more of a gradual onset. It will creep on over months, years, that sort of thing. Okay. Before we move on, any questions regarding symptoms? Go for it. Sorry, I'll wait. Yeah.
Lifetime.
How long?
Repeat that question, sorry?
Sorry?
Repeat the question, sorry?
I said, can you tell me how long someone suffering with diabetes is supposed to take the insulin? For how long?
Oh, I mean, for that it depends. So for type 1 diabetes, when you're the way you treat type 1, we'll explain later, will be with insulin. Unfortunately, for type 1, it's lifelong. So because the cells don't get replaced in the pancreas, the beta cells, they're quite specialized, and when they get damaged, they don't get replaced. So for the whole life, they'll have to take injections to replace that insulin.
Thank you. Are there any cure for diabetes? Any medicine to help
sorry, go on. Sorry.
Any medicine to help to cure this diabetes? Is there anything?
I'll explain more later on, but essentially with type 1, there's no, from my knowledge anyway, there might be some stuff in development, but there's no solid cure for it. We just treat it with the insulin injections. With type 2, I think you mentioned, it can be reversed, but we'll explore that later on. Yeah.
Type 2
Yeah.
diabetic people.
Yeah.
How they move from, can they move from type 2 to type 1? How can that happen from type 2 to the deadly one, type 1?
So usually it's a different mechanism. So for type 1, the mechanism is that the immune cells target the pancreas, and that's how you usually get type 1. And it usually leads to like a destruction of all the beta cells. Whereas with type 2, essentially as the pancreas has to make more insulin to compensate, it does lead to some of those beta cells getting damaged. So you get a reduction in your beta cells, but they're still there, but just less of them. So it doesn't necessarily transfer onto becoming type 1. Does that make sense? Okay. Go for it.
With the symptoms for type 2, is it a common one, or it might be a few people who experience that it affects your nerves and you get like cramp-like feelings or a dead-like feeling in your hands?
With the so yes, that is one of the complications of type 2 diabetes. It can affect your nerves. I'm not sure about the cramping, but essentially you can get reduced sensation and an odd sensation like pins and needles in your hands and feet. So that's one of the complications, and I'll explain why that's really important, because the damage to the nerves can lead to a lot of other problems.
I'm sorry, I'm talking to you.
No, it's all good. Go for it.
When I have type 2 diabetes, and it's going down.
That's good.
I'm like 50 now, it's going down.
That's good.
But I started 83. But when I get to know, I was walking on the road and I was chipping.
Yeah.
My foot, that's the only way, chip, and my head would go like, so I'm like, okay, let me go to the doctor and check out why my foot is chipping and why I'm feeling like this. And then she gave me some exercise and she said, well, yeah, you have diabetic type 2. But to God be the glory, I'm in control. So hopefully when I go back to the nurse next time, it will be like 18.
To be fair, 50 is quite good.
Yeah, because I started 89. It was 89 and then it got down to 50.
That's good. That's good. I think like if it gets below 48, then that will be, you'll essentially be in remission. So that's good. Yeah. Cool. I'll explain what all those numbers mean later because I've got, it's on there. Yeah. Cool. Yeah, we'll move on. Sweet. So, yes, so complications. So just to preface this, this is why it's really important to catch type 2 diabetes early rather than late. Because although you might not have symptoms of the type 2 diabetes itself, when you develop complications, it can lead to a lot of problems that you ideally want to avoid or prevent from progressing. So, essentially, I'll go through this one by one. The first complication I'll explain is it can sometimes damage your kidneys. Now, with kidney damage, you don't get symptoms immediately, but as it progresses, it can lead to things like increased blood pressure, problems with balancing your electrolytes. So just to get into that bit, your kidneys are really important for getting rid of excess potassium. I don't know if anyone's aware of all that stuff. If you have damage to your kidneys, you can lead to a buildup of potassium, and that can cause a lot of problems. So ideally, you want your kidneys to be working pretty well. But essentially, yeah, so diabetes, if it's not caught and it's going on in the background and you don't know about it, slowly it'll be wearing out your kidneys. So it's important to catch it. And the other thing as well is that damage to kidneys can lead to anemia down the line as well, which is where you haven't got enough hemoglobin. Does anyone know, do you know what I mean by hemoglobin in your red blood cells? So it helps to carry oxygen. Damage to kidneys can lead to that being less, and that can make you quite tired, sometimes a bit breathless, and you'll get a bit paler as well. So those are some problems that can result from that. So that's the first complication. The second one is, I think someone mentioned nerves. So yes, it can damage the nerves. And this is all linked to the increased amount of sugar that's in the blood. So because it's not in the healthy range, and because it's so high, it leads to these complications. So going back to the second complication, to the nerves, it can cause odd sensations in the hands and feet, like pins and needles, and loss of sensation. That's really important because if you have loss of sensation in your legs, you're more likely to get things like ulcers. If you're getting a lot of ulcers in your legs that you can't feel, you're more likely to get infections. And if that infection progresses without you knowing, it can spread and it can go into things like the bone, etc. And that's why you might hear of people having amputations. It's usually because they've had an infection of the skin, they've not realized it because they can't feel anything, it's spread to the bone, and before they've identified it, it's now spread up to maybe like the ankle. It's not pretty. So ideally, you want to avoid it getting to that point. And if it does get to that point, you need to have regular checks to make sure that it gets picked up. So any infection, it gets treated before it progresses on to get into the bones, etc. So that's in regards to the loss of sensation. You can also get other things as well. Has anyone heard of the term postural hypertension before? Bit of a fancy name. Essentially, it affects people usually as they get a bit older. You know when you sort of stand up, so if you're sitting down, if you stand up too quickly, sometimes you can sort of like have a bit of a faint. That's what postural hypertension is. It can happen sometimes if you're a bit dehydrated, but if you've got diabetes, it can lead to that happening more often because it has an effect on the nerves, and the nerves are important for preventing postural hypertension. And it can also cause some other problems as well, such as like stomach motility problems and erectile dysfunction. But I'll move on from those. So the third complication is that it can increase your risk of infections. Now, some of that is tied to the loss of sensation I mentioned before with the development of ulcers, etc. But also it just in general leads to more infections because, how do I describe it? You know, like things like bacteria and bugs, they have to feed, right? And some of the things they feed on is sugar. Now, if you have more sugar floating about in your blood and so forth, that's more food for them, if that makes sense, and it's more accessible to them. So you're more likely to get infections in your skin and so forth. Also, because you've got so much sugar in your blood, your body tries to get rid of it and it tries to pee it out. So you've now got a lot of sugar in your pee, which is kind of gross. But that serves as food for the bugs, so you're more likely to get urine infections. And then I've mentioned thrush as well. It can happen like tongue and elsewhere and so forth. So that's in regards to that. And then the fourth complication is it can damage your eyes. So it can impair your vision. And the way it does that is that it can damage your retina. It can increase your likelihood of getting cataract. And has anyone heard of glaucoma before? So it can increase your chance of getting glaucoma, which is where you have increased pressure in the eye, and that can be quite a dangerous condition if it's not caught. Okay. Any questions in regards to this? Go for it.
There's a new one going around. We talk about type 1 diabetes and type 2, but a lot of people now, they say they have pre-diabetic.
Yes, I'm gonna. Yeah.
So what about the symptoms with that one and things like that?
That's a good point. I was actually going to talk about pre-diabetes. I'm going to park your question until we get there, but I'm glad you brought it up because it's quite important to be aware of that as well. But yeah, hi. Let's go. I'll go you first and then you afterwards.
Who's first?
What I'm saying is, I met a lady once, and she was suffering with diabetes for a long time.
Yeah.
And she showed me a little tiny tree that grows on the ground. It rests on the ground itself. And she says to me, somebody gave her that medicine to her. He said to her, take it, pull it from the ground, wash it 3 times, and go and get fresh milk, not the milk they sell in the shop. So the cow milk comes from the cow, because she had a cow as well. And she said, the husband milked the cow for her, and she boiled this tree with the milk.
Yeah.
And she drank that for several days. And when she went back to the hospital, to the doctor, he couldn't find a trace of the diabetes.
So I didn't catch everything. What was the last thing you said? Sorry.
They couldn't find a trace of the diabetes. It was completely gone.
Okay, so as in like they didn't have diabetes afterwards.
Diabetes. I don't know what type she had, but she couldn't find it.
I mean, I don't know because it could have been linked to that, but it could also be linked to other factors. But I wouldn't be able to. Yeah, from what I understand, I think like we'll get onto like things that can sort of like reverse diabetes. But one of the things is like having like low-fat milk. But I don't know. I don't know if milk itself like can reverse it. But yeah, go for it.
You mentioned about potassium.
Yeah.
High potassium earlier. What if you have a good kidney function and you are like borderline, say you're like 46 there, I wouldn't want to say diabetic because you're not in diabetic stage, to be the pre-stage.
Yeah.
What else could cause that potassium to be high?
If your kidneys were fine, you mean? Do you mean if your kidneys were working okay?
Yeah.
I mean, it would be unlikely if your kidneys are working okay. Usually, in all the cases I've seen with a high potassium, it's always linked to kidneys. But I guess if you ate a lot of potassium, like through like, say if you ate like 20 bananas or something like that, then you might get a little bit of an increase above the normal range, but usually it's linked to kidneys. So it would be I've not seen a case where someone's had high potassium and it's not been linked to their kidneys. But that's just, I've only been practicing a couple of years, so. I know what you mean, yeah. You're talking about, it's basically a value called the GFR. It's how well the kidney works. Usually, if it goes below 60, then that's when we sort of say that it's below the normal working value. It's usually when it's very low that you start getting problems with potassium handling. But yeah. It depends. So sometimes if it's in the first couple of days, it might be able to be reversed. But if it's chronic, so if it's been low for months, usually it doesn't get reversed. Yeah. But then if it's like a couple of days that it's gone down, you might be able to bring it back up to the, yeah. Anyway, yeah, sorry, go on. It depends. It will depend if it's like the first few days. Yeah. Yeah, definitely. I've seen a lot of cases where people, like, they're dehydrated and that has a hit on their kidneys. It brings down the value, and then we just give them fluids and it brings it back up. But if it's the case that it's not treated and that goes on for weeks, then it might remain low because it's now permanently damaged. Yeah. Anyway, I'm going to move on. But I'm glad. I like the questions. But we'll do a Q&A at the end. Right. I'll go. Do you mean for the blood sugar? Oh, I know what you mean. Yes. Because with the American values, I actually don't know off the top of my head what the ranges are. Because I know in the UK we use it's like, the 4 to 7. Yeah. I think in that scenario, if you have the American value, you have to Google it, because I don't know off the top of my head. But Google is your friend. But yeah, I know with the English values, it's like 4 to 7. That's the normal range. Right. We'll crack on. So there are a few more complications I want to briefly touch upon, which are still quite important. So if you do have diabetes, it can increase your risk of getting strokes. Is everyone familiar with what a stroke is? So essentially what it results in is that you have sort of impairment of the blood supply to part of your brain, and that can result in, I think everyone's familiar with FAST, where you get the facial droop, unable to use your arm, your leg, etc. It's very important to identify those symptoms. If you notice those symptoms, pop to A&E. Okay? But yes, so diabetes can increase the risk of developing a stroke. It can also increase your risk of developing what we call coronary heart disease, which is where the blood vessels that sort of supply your heart get clogged. That's really important because if that progresses, it can lead to things like angina, and it can lead to heart attacks. So diabetes, especially if untreated, can increase your risk of getting things like heart attacks. I've also put on here peripheral vascular disease. Essentially, it's similar to the coronary heart disease, but it happens elsewhere in the body. So it can happen in your legs. And in those individuals, say if you go for a walk, it makes your legs very painful because it impairs the ability of the blood to get to the muscles in your leg. So it's what we call claudication, or lower limb claudication. And diabetes can increase the likelihood of developing that. And then the last one is it can increase the risk of heart failure. Heart failure, to keep it brief, is when your heart isn't pumping the blood as well as it can, and it can make you a lot more tired than usual. It decreases your exercise tolerance. So say before you can run like a half marathon, if you have something like heart failure, you'll struggle to walk like a couple of meters sometimes, or even a mile. And it can also result in shortness of breath and leg swelling as well. Right, and I think we've touched upon the bottom two I've mentioned there as well. I'll keep it brief. With the ketoacidosis, that's more so linked to type 1 diabetes. The other one, with the long, very scientific-looking name, I'm going to call it HHS, that can be linked to type 2 diabetes. How that results is when the blood sugar is so high that the person becomes very dehydrated. But that's usually in like very severe cases of type 2 diabetes. I won't go on about it too much, but it's just something to be aware of.
So what would you do if in the event your sugar level goes right up and you've already taken the medication that you're supposed to?
If
say, for instance, it's one a day or new metformin
yeah.
Twice a day, but during the day you find yourself having a high value of your blood sugar level
Yeah.
has gone up. What do you do?
In that scenario, if it keeps going up above the normal level and it's not very, very high, then it would be you go to your GP and they will adjust your medications. If it's extremely high to the point, I think the normal range is like 4 to 7. Say if it was above 30, then usually you will get symptoms of dehydration. In that scenario, yeah, you'd have to pop to A&E because that's when it becomes a bit more dangerous. That's the HHS that I've mentioned there as well. But you'll usually get symptoms with that. So you'll feel dehydrated, you'll feel dry, and that will prompt you to check your blood sugars and so forth. Anyway, let's move on. Right, so how to identify it. So I mentioned that with type 2 diabetes, sometimes, or a lot of the time, people don't have symptoms. So it can go undiagnosed. So how do health professionals identify people that have diabetes? Usually it's down to risk factors or how high risk someone is. So what they'll do is, your GP will do, is they will look at your age, whether you're a smoker or not, whether you've got high blood pressure, whether you're male, or whether you use steroids, not the anabolic ones that you see on like TV or whatever, but like a different kind. So basically it's like a similar drug to cortisol, the stress hormone. So those sort of steroids will increase the likelihood of getting diabetes. If you've got family members with type 2 diabetes, and if your body mass index is above normal range. What I mean by body mass index or BMI is whether you are in the normal range in terms of your weight or whether you're more overweight or obese. So if you're overweight or obese, that's a risk factor. So if you've got a lot of those risk factors checked, then your GP might contact you to say, okay, I'd like you to do a blood test just to make sure that you've not got diabetes undiagnosed. You can also probably, if you were worried about it as well, and you thought you had a lot of those risk factors, you can also just book an appointment with your GP and say, I'm a bit worried, I just want to make sure I haven't got diabetes, that sort of thing. Right, so like I mentioned before, if they identify you as being high risk, then they might call you in to have a blood test. So there are two things they'll check. So the first thing, they'll check the actual blood sugar level. And the second thing, they'll check, someone mentioned it, was it yourself? There's a value you mentioned. Essentially, that's what we call the HbA1c. You'd have to remember that name. It's just a fancy name. But what it represents is the average blood sugar level over the past 2 to 3 months. So it's like an average. The normal range is it's usually below 41. If it's above 48, then that's what we'll class as diabetes. And between that, someone mentioned pre-diabetes, that's where it's borderline, and usually it requires some monitoring to make sure it's going in the right direction and not progressing on to diabetes.
But does your age represent the value of your sugar level? Because for me, I have chronic diabetes. But 4.7 is too low for me, very low.
Oh, you mean, 47?
Yeah, 47.
Yes.
Very low for me. It has to be all the way 7 something.
Yeah.
If it's 47, then I start shaking and all this. I have the hyper.
Yeah.
Something.
I think in people that have established diabetes, the normal range can vary because your body gets used to having a lot of sugar in the blood. So if you bring it down to that normal range that you get in a normal individual, you might get symptoms of having too low blood sugar. So what we like to do sometimes is, if you've had diabetes for some time, we will adjust your personal normal range to a target level. So for you, it might be something like 8 to 14 rather than 4 to 7. Yeah. So that would work for yourself.
Yeah.
For someone like that doesn't have diabetes, that would be abnormal. But for yourself, that is a good range.
Yeah.
But yeah, so that's a good point. We'll move on. Any other questions, or are we good? We'll do questions at the end. We'll get moving. Yeah, so as I mentioned, normal blood sugar level is 47, and then HbA1c is 41 and below. Right, so you don't have to remember all these values. This is like extra information for like, I don't know, if you want to do like a medical exam or something. But like, if your fasting blood sugar level, that's when you've not eaten any food for some time, is above 7, then that is a possibility. It's a possibility that you have diabetes. And there's another test as well, where if your random blood sugar level is above a certain value of, say, 11.1, then that again could point towards you having diabetes. And then we mentioned the HbA1c. If it's at or above 48, then we'll say you probably have diabetes. Okay? We like to repeat it more than once for individuals just to make sure it's not a spurious result. But if you have symptoms of diabetes, then we'll probably diagnose you of that first result. Okay? If you get diagnosed with diabetes, monitoring is really important. So essentially, we want to make sure that your values are going in the right direction. So initially, the monitoring we'll check your blood sugar levels every 3 to 6 months. And then from then on, it will be 6 monthly. And then someone mentioned pre-diabetes, which I'm going to get onto in a bit. Yes, so for some individuals, their blood tests are borderline. So it doesn't meet the criteria for diabetes, but it's not quite in the normal range. We call that pre-diabetes. Now, with pre-diabetes, you won't have any symptoms. You haven't got diabetes, but you're at risk of developing diabetes. And that's because your non-modifiable factors, say your age, will slowly creep you along to develop diabetes. So it's important you're aware of it so you can start to target the modifiable factors such as exercise, diet, etc., so you don't progress onto developing diabetes. You don't have to worry about the values. That's like if you're super keen. But essentially, 1 in 7 adults in the UK, on average, have pre-diabetes. So it's really important to be aware of that, because if you're aware of it, you know what you need to be doing to avoid developing diabetes and avoid developing all the complications that come along with diabetes. Okay. Monitoring for pre-diabetes, it's usually yearly. So they'll usually check your blood sugar levels every year rather than every 6 months or 3 months. But it's still something you want to be aware of so you're doing the right stuff so it doesn't tip over to diabetes. Hi. Sorry? Oh, I'll wait. I'll get that mic, yeah. Hold on. Oh, how many types? Multiple. It's more than 2. The main ones are type 1 and type 2. There's also, I mentioned gestational diabetes. That occurs with pregnancy. I'm not going to dwell on about it or talk about it too much, but it's something to be aware of, especially if you're like considering getting pregnant and so forth. There are a few other ones as well, but they're a lot more niche. I don't know if you've heard of MODY. It's another one. It's not that common, but it's similar to type 2, but it affects younger people. And there's another one as well. I can't remember off the top of my head. It's similar to type 1, but affects older people as well. But I won't drone about them. They're a whole other thing, and they're not that common for me to talk about. Right. Any other questions? Sorry? Oh no! No, it's more because like I don't want to like. I think because the main like topic for today is type 2 diabetes, just because it's so common, and we have like a formatted way to deal with it as well. The other ones are not that common at all. Like MODY is not that common. Like I've not seen a case at all. Exactly. So like if it was more common, I would probably talk about it. But it's very. Yeah. If I've seen a case, I'll be like, wow. You know what I mean? That's how uncommon it is. Sorry? I've never seen a case of MODY. I've just read about it in like medical textbooks and stuff. But yeah. Anyway, let's progress. Perfect. So this is the main topic. How are we gonna manage or treat diabetes? What is in our power to prevent us from developing or keeping this condition under control? Right, so I'm going to briefly talk about the treatment for type 1, but that's not the main thing I want to focus on. Someone mentioned insulin. So for type 1, because the problem is to do with the pancreas not making the insulin itself, all you have to do is replace the insulin with injectable, and that solves the problem. Because the cells in the body still have a good sensitivity to the insulin, so once the insulin's there, it does the job. There are some, obviously, like, I don't want to talk too much about type 1, but there are some, like, things about titrating the insulin so you don't overdo it and crash your blood sugar levels and stuff, but that's for the GP to sort out with the type 1 diabetics. But, so the main treatment is insulin injections, and sometimes in some individuals they might have metformin as well, but I've not seen that myself. It's usually the insulin that they'll inject. So that's type 1. We'll move on to type 2. So, can everyone see the red text? Oh, they can't. Okay, I'll read it off. Sorry about that. So, the way we encounter type 2 diabetes, the main 3 ways we target is diet. Oh, thanks. That's perfect. Diet, exercise, and weight loss. So, I'll focus on diet for now. I'm going to open up to the floor. what do you think you need to do to sort of improve your diet to prevent getting diabetes? Perfect. Yeah, that is literally everything I got on the board. It's literally, yeah. So like you mentioned, like eating whole meal food. So rather than white bread, there's like wholemeal bread you can get. The reason why you do that is because it has a lower, what we call a glycemic index. Fancy name. All that means is, even though it might have the same amount of sugar, the sugar is released slower. So it doesn't spike yeah, exactly. It doesn't spike your sugar. It gets released in a slow, managed way, which is better for your body. You mentioned fruits as well. Go for it, yeah. Sorry? I think it should be I mean, like, it's still, because it still has, like, fat, right? But I think people like to enjoy their foods. And I think with a lot of these ways of managing your diet, you want to strike a balance between enjoying your food and eating healthily. So if you enjoy drinking milk, like with your cereals, it's more, yeah. Sorry? Okay. Okay. I mean, I guess in that scenario, it'd be more of a different issue in terms of like how they treat livestock and everything. But I'm not qualified to talk about that. You know what I mean? But it's still a point that yeah. Yeah, but yeah, if you're, it's a good point. But I'm a doctor, not a yeah. You know what I mean? But yeah, skim milk is better than like. But yeah, yeah. So you mentioned milk. You mentioned fruits. So fruits are a good way. Most fruits, anyway. I've got like a list up there. There are some fruits that aren't the best, but most fruits have a low glycemic index, like cherries, grapefruit, etc. Pears, apples. Those are good fruits to eat. You mentioned cutting out things like red meats, which are high in saturated fats, and fried food as well, which can have high trans fats. And then you missed one thing. Oily fish is quite good for you as well. So like mackerel, salmon, sardines, etc. They're high in omega-3 fatty acids. Those are good to eat as well. But I think whoever said the thing, you literally got all the points. It was you. Yeah, you had everything. It's good. Well done. So that's diet. I'll move on to the next one, which should be exercise. So actually, on the point of diet, like I mentioned, it's all about moderation, right? So it's all about, exactly, because if you go too extreme, you'll keep to it for a week. So you'll keep to your diet for a week, and then you'll say, no, this is too much, and you go back to eating like cakes every day. So you want to strike a balance between what you like and what's healthy. And exercise is the same thing. Like, yeah, go for it. I'll wait to the mic. I can't hear you properly. Yeah. You mind repeating it?
Yeah, I don't know. A lot of people say the type of oil you use to cook with is also important, because some of the oils we use are inflammatory. And because diabetes is a sort of inflammatory disease.
I think in terms of the oil you use for like cooking and frying, there are probably like, I think they're all going to be generally unhealthy, but there are healthier, how do I describe it? Some are more healthy than others, if that makes sense. I don't know off the top of my head which ones are healthiest, but if you look online, there are probably some resources. I got some resources as well at the end that you might be able to find which ones are best. Yeah? I'll move on. So exercise. Water's good as well, keeps you hydrated. Specifically for like diabetes, it's not going to prevent you from getting diabetes, but it's good for kidneys and so forth. So still stay hydrated. So exercise. It's good to do it in a way that is manageable long term. There's no point trying to run like a marathon and then after that you don't do anything else. Like, yeah, it's not going to work. So like, especially if like you're working like most days of the week, right? You want to do something that you're not like shattered and you're able to still do things like afterwards. So like, even if it's something like for 30 minutes you do like a brisk walk, right? After work, do it with your mates. That is something, right? Whereas if you go too crazy with it, you're not doing that long term. Essentially, what they recommend is about 150 minutes of moderate exercise, so like brisk walking, a bike ride, etc. And throughout the week, you want to cover those 150 minutes. Alternatively, something like 75 minutes of high-intensity exercise, so like doing a run, going for swimming. If you like football, do football. That also works as well. And you want to cover those minutes over the week. Ideally, you want it to be consistently done throughout the week. You can also do like light activities daily, which helps, okay? And avoid sedentary activities for too long. So if you're a gamer, probably don't game for like 8 hours a day. That's not a good idea. Probably 1 hour is fine, maybe 30 minutes. So that's exercise. And then for weight loss, essentially you want to bring down your weight into the normal BMI range. So what is BMI? BMI, body mass index, essentially, it's a ratio of your height and weight, and the value that we usually aim for is 18.5 to 24.5. Perfect, yeah. If you sort of creep above 25, then you're now in the overweight category. So 25 to 29.9 is overweight, and above 30 is obese. So ideally, you want to bring it down to the normal range, but if you're a bit higher up, then you don't want to crash it too quickly. You want to bring it down in a more manageable way. So aim for something like 5 to 10% initially of a weight reduction, and that's perfect. That's a good target. Okay?
Dr. Somebody mentioned oil.
Yeah.
How do you differentiate polysaturated and saturated oil?
There will usually be like a label on it. Off the top of my head, I don't know. I have some ideas, but I can't substantiate it. I've not fact-checked it, basically, so I don't want to say. But if you look online, there'll be resources that you can use to see what's higher in, yeah. But yeah, you mentioned saturated fats, you mentioned unsaturated. So like, polyunsaturated fats are better than saturated fats. So if you have an oil that's high in unsaturated fats, then use that. Still, probably don't flood your food with oil, but like, you know, that's probably better than like, yeah, if that makes sense. Perfect. So that's for weight loss. Other modifiable factors. So if you're a smoker, I think some people like enjoy smoking. That's fine. But bear in mind it will have an effect on your health, and part of that is that it will increase your risk of getting type 2 diabetes. So if you do enjoy smoking, maybe try and cut down a bit, or maybe stop altogether as well. And if you're thinking of stopping, then there are nicotine replacement therapies that you can acquire via your GP, such as patches, lozenges, etc. And those are good alternatives to smoking, and that will help to reduce your risk of developing type 2 diabetes. Right. Okay, so that's all for like lifestyle factors. In people that have tried the lifestyle factors, sometimes their blood sugar levels aren't controlled. So to control it, sometimes they'll start on some medications. Someone mentioned metformin. That's usually the first line that we start. There are some other medications I won't get into, but if it's still not controlled with the metformin, then they'll start those medications. And then as a last sort of line, if you've been on loads of medications and it's still not controlled, then for type 2 diabetes, sometimes they start insulin. But that's not commonly started initially. That's like later on if it's still... Exactly, yeah. For type 1, it started immediately because it does the job and it solves the original problem. For type 2, it's more of like down the line sort of thing. Okay? Sweet. So, to summarize, diabetes, it's a condition where you have your blood sugar levels and it's higher than normal, okay? And it's usually chronic. There are different types. The main ones are type 1, type 2. Type 2 is the one we focus on mainly today. And type 2 diabetes can be avoided, delayed, or controlled by addressing your modifiable factors. So if you haven't got it yet, you can do the modifiable stuff like exercise, weight loss, etc., to prevent you from getting it. If you're borderline, you can delay the onset of it by doing those bits and bobs. And the more you delay it, the better, because it means you're less likely to develop complications. So you can live a long life even if you have diabetes, but you've got to keep it controlled. And then the final thing is, if you have it, like I mentioned, you keep it controlled by getting exercise, losing weight, stopping smoking, improve your diet. Okay? And I think those are the main points that I've got to say. And Bob's your uncle. That's everything. So I've got some resources here. I think they've got my slides. So if you want it, you can either jot it down or just ask them afterwards to sort of like get those. So diabetes.co.uk, diabetes.org.uk as well, and then nhs.uk. Those are good resources. And then I've also got a resource called patient.info, type 2 diabetes. And yeah. Questions? Yeah. There you go. Sweet. Let's start on this side. Yeah, go for it.
Thank you very much for your presentation.
It's all good.
2 questions. A few weeks ago, the Secretary of State for Health, who's MP for this area,
yeah.
coincidentally, spoke about releasing or approving fat reduction medication for treatment of diabetes. Can you tell us a bit about that, and if you find it effective? And the next one I want to ask, 2 questions I want to what extent you're familiar with the term diabulimia? No, you're not.
That one I'm not familiar with. I'll look into it. It's probably a paper.
All right, let's ignore that one.
But I'll focus on the first question. So I think,
okay, cheers.
Are you talking about the GLP-1?
Yeah.
Yes. So essentially, it's not first-line treatment. It's more third-line. So if someone's got type 2 diabetes, first thing you do is you start them on, you do the lifestyle changes, and maybe you start metformin. Second one, there'll be some other medications you might start, like, to throw names out there, I can't say it myself, empagliflozin, and some other ones as well. That's your second line. And the third line, if the person has a large, like a high BMI, they might start these injections, and they're basically what we call GLP-1 analogs. So how that works is it works by mimicking a hormone that's produced by your gut, and that hormone increases the amount of insulin your pancreas produces, and and that helps to compensate for the reduced sensitivity in the cells. So that's how that works, and that also helps to decrease your weight as well. So some people use it to sort of do weight reduction. So it helps with the weight, and it helps with controlling your blood sugar levels.
Thank you.
Yeah, next one.
There's 2 questions I would like to ask. If you're pregnant and you take insulin, does that affect the child at all?
No. I think insulin is generally safe to use in pregnancy. So people that have gestational diabetes, the way it's treated, I think it's usually treated with exercise, all the lifestyle factors, metformin, and usually as like a second, third line insulin. The other medications, I don't think they're allowed, but metformin and insulin are fine, I think.
Okay. And then next one. About 3 weeks ago, my sugar level was about 34.
24?
34.
34?
Yeah.
Okay, that is quite high.
Yeah, it was high.
Yeah.
And I had to rush to hospital. And then they gave me some drips to bring it down.
Yeah.
And this is how I felt. I've got brain fog, pins and needles, weakness, dry mouth, like something stuck in my throat.
Yeah.
And I couldn't even put food on my, hold food to get into my mouth.
Yeah.
I was that weak. Right, so they gave me metformin.
Yeah.
And I took it just about 3 weeks ago.
Yeah.
And then I came home and I started not to love change of my diet.
Okay.
No carbs. I just eat vegetables and salad. And now my blood, when I checked my blood this morning, it was 5.7. Amazing, within 3 weeks.
That's really good.
So
Fantastic.
you can't reverse it. And exercise as well.
Yeah.
Every time I eat in the evening, I go exercise, I go in the morning. And now my question is, because my diet was so strict, can I go back and eat a little bit of carbs or?
I think my answer to that is in moderation.
In moderate.
I think in life we have to enjoy life, right?
Yeah.
So, I mean, if it was me, I don't think I can eat fruit and veg all day, every day. I'll get very bored.
Yeah.
You know, I'm gonna have I'm gonna have a Skittle every now and then, right? But it's about having it in moderation, and it's about having the right carbohydrates. So if you are gonna eat something with carbs, if you're making a pasta, use wholemeal or whole grain pastas rather than like the white pasta. Stuff like that. So yeah, go for it. Just like moderation and the right stuff, and you'd be fine. And then keep with the exercise as well. Yeah, no worries. Okay, anything else? Hi.
Like, okay, you don't want to eat sugar,
Yeah.
cakes and all those kind of things. Next thing you drop on the road, and they send you to eat chocolate. Somebody quickly bring you a chocolate which is sweet, and it bring you back up.
Yeah.
Don't eat sugar, don't do this, but you drop. But here it goes, here's a chocolate, eat, and then you revive.
I think
what's going on with the diabetic thing?
So, so that's typical of type 1 diabetes. So with type 1 diabetes, they take insulin, isn't it? And that's to help to replace the insulin that doesn't get made by their pancreas. Now, if their insulin is not been titrated properly, or if, like, for example, they're on a certain dose and their body sort of adjusts in a way that makes the insulin a bit more potent, then that can crash their blood sugar level. So it goes below the normal range. And that in of itself is another problem. So that's when you get people that are confused, lose consciousness, etc. So the way you treat that is give them sugar, because it brings it back up. So that's why they give them chocolate. Yeah.
Who's next?
Look at this lady speaking.
Metformin, that normally, 2 questions I have. Metformin, does it affect your kidney? Because I hear most people complain.
I think the main side effect of metformin is that it can cause problems with your your gastrointestinal tract, or like your intestines and so forth. So I think usually what we do is, if we start you on metformin and you've got those side effects, we change it to like a modified release version, and that can sometimes reduce the side effects. I don't know if it has an effect on the kidneys per se. I've not seen that as a common side effect. It might be a less common side effect that I'm unaware of, but I don't think it's one of the common ones.
Okay. And the second one, they said I'm borderline diabetes. I'm barely, because the age
HbA1c.
it's like 42, the highest 43, then sometime it goes back 39. But I find I get more symptoms of diabetes, and the doctor said, well, we can't do nothing because you are not diabetic. So I don't know how to treat that one.
What symptoms do you?
I even get like dry mouth. I get sometimes, when you eat, you want to just sleep. Really feel like you want to just sleep, and sometimes urinating often.
Okay. Those are symptoms. What you can mention as well is that with the HbA1c, that if it's not in the range of being diabetes, it doesn't rule it out. We also need to check the fasting glucose level, or the fasting sugar level. And what we do is we give you a bit of glucose, and we check your sugar levels after 2 hours. And if it's all within the normal range, then it's not diabetes. But even if your HbA1c is normal, if those tests are abnormal and above a certain range on 2 occasions, then that's still classified as diabetes. So you could probably pop that to your GP and say you want to do those tests, just to make sure you've not got it.
And what's the test called?
It's like a fasting sugar level test, a blood test.
Because even my body is a bit weird because I bought a test, and sometimes if I feel like, wow, my head feel a bit strange, it tests, it might be, if I go like 6.5, I feel very strange. It have to be under like about 6 or so for me to feel okay.
I mean, it could be linked to that. It could also be linked to something else. I've not assessed it myself, so I couldn't say per se. There could be like something else that's causing your symptoms, but that's what I would say, because usually a value of 6 is generally okay, especially if you haven't got diabetes. Yeah, 6 isn't too bad, because it's usually 4, especially if you haven't got diabetes. 4 to 7 is But yeah, it is individualized. I think because you've got pre-established chronic diabetes, then that range changes. But someone that hasn't got diabetes, the normal range would be 4 to 7. So if it deviates outside that, then that's when it becomes problematic. But if you've got established diabetes, then we wouldn't use the normal range as your range. We'd have to personalize it so it actually fits how your body has adapted. Sorry? Oh, hi.
Yeah, hi. Did you mention, I might have missed it earlier, did you mention anything about salt intake? Because obviously, I mean, when I was younger, I always thought diabetes was about sugar. And then obviously, it's not just about sugar, it's also about salt as well. So is that a factor of what we should be doing, like reducing salt? I mean, we're not supposed to have a lot of salt anyway, but, you know, is that something that we should consider?
I think a high salt intake, from what I've read and what I understand, directly, salt intake or high salt intake doesn't result in an increased chance of diabetes. However, high salt intake can increase the chances of you developing high blood pressure, and high blood pressure is a factor that can increase the chance of developing diabetes. So indirectly, yes, but not directly. Yeah.
So are they correlated? High blood pressure and diabetes?
Yes, yeah, they're linked. So they can sort of like, if you have one, it can increase the chance of getting the other. Yeah. Go for it.
Sometimes without diabetes. Now it's like a trending thing the young people are actually taking. They're even buying it online.
Yeah.
That they're injecting themselves for them to lose weight because of the tummy too high.
Yeah.
So a lot of the ones that Errol is speaking about is not diabetic people at all. Those young people just taking those injections.
Yeah.
I think they sell it for like 170 something pounds.
Yeah.
Online that they can buy it, and now the GPs are prescribing it now.
I think with every medication, there's risk and benefit. Yeah. So with those medications, there are certain criteria that as GPs will use to prescribe it, usually if the BMI is really high.
Yes.
So there are 2 reasons why we'd prescribe it. It would be for diabetes as like a third line, and for weight loss if the BMI, I think it's above 35, but don't quote me on that. I'm not exactly sure what the cutoff is. If they don't meet that criteria, we won't prescribe. For people that take it, if they've not met that criteria, then you might get some benefit, of course, because you might lose some weight, but ideally you want to lose it by other means or more conventional means, because that medication has side effects that can result. Some people are fine with it, but there's one side effect that's really serious that some people can get. I don't know if people have heard of pancreatitis.
Yep.
So that's a very serious side effect that a few people that take that medication can get, and that results in people getting hospitalized. Yeah. So if you don't need to take it, then don't take it. But if you do need to, then the benefit outweighs the risk. So
it is. Yeah. Because I have about 5 or 6 of my carers are actually taking it. None of them is diabetic at all, and they're all taking it for weight loss. And I'm saying your body makes its natural insulin. Why are you injecting insulin to yourself again on top of it?
I mean, they're adults, right? So, you know, but My advice would of course be don't take it unless you meet the criteria, but that, people will do what they're going to do. Yeah. Anyway, anything else? Hi. We'll do one or two more questions and then we'll call it.
I know Sister Fletcher is saying that if you do not have diabetes and you take it, but what if your GP said that your BMI is a bit high?
Yeah.
And they prescribe that for you. Should I accept it?
I think...
Because I'm not diabetic.
No, I think in that scenario, because having a really high BMI has risks. So, of course, it can increase the risk of getting diabetes. It can increase the risk of getting other conditions as well. So, in that scenario, the benefits start to outweigh the risk, but you're not forced to take it. If you feel that you want to lose that weight through other means, you can say, I think I'm going to hold off on that for now. I'm not keen on having that medication. I'm going to try other things to get my weight down. But if you're fine with it, then you can take it. It's all about risk-benefit, and in that scenario, the benefit would outweigh the risk. But if your weight wasn't that high, then the risks now start to outweigh the benefit. Does that make sense? Okay, last question.
A lot of people now like natural remedies. So do GPs or doctors prescribe that also, natural, or they just stick to the conventional ones that most people, because conventional ones have quite a lot of side effects. And then you give something else to counteract that side effect, and that's what's going on. But natural remedies, a lot of people go that way now.
I'd say as a doctor, so the way we sort of like prescribe things and practice is that we go off evidence-based medicine. So we use things like trials and tests and so forth to determine what is showing evidence of working and what is showing evidence of not working and so forth, and we use that to prescribe. With natural remedies, there might not be as much evidence out there to say that it's good to take for this medication. So from us, we can't advise you to take it, but if you want to take a natural remedy, you can, at your own risk, of course. But because there's no evidence, we can't say, okay, I think you should take this, because we have to go off the evidence. And there have been multiple times when a drug seems like a good option, and then more evidence comes out, and then it gets sort of like pulled back as like a fourth line rather than first line. So there's always new evidence coming out, but yeah, for natural remedies, if there's not much evidence, then we can't speak on it, if that makes sense. But it's up to you. If you want to try it, you can, but just at your own risk, because we can't advise on that, that's all. Oh, yeah. I can't say. Empagliflozin, yeah. All these fancy names, yeah. Yes. So the way it works is that it makes your body pee out more glucose or pee out more sugar. So that helps to bring down your blood sugar levels. But as I mentioned before, if you have diabetes, you will pee out more glucose anyway, and that increases your risk of getting a urine infection. So this drug means you pee out even more glucose. So yes, it brings down your blood sugar, and if you need to have it, then take it, of course, but the side effect you can get is you can get increased risk of urine infections. So like I said, also risk-benefit. If the benefit outweighs the risk, then go for it, but just bear in mind there is still that risk that's there. Okay? Okay, last question. Go for it. So? Yeah.
He liked to talk thinking, I don't know. He always reads some kind of book. And he said, this doctor said, when you go to the sauna and you're sweating it out and you're drinking water, it's good for diabetic. I don't know how to treat it because I'm just sweating out, you're drinking. You sweat out, you're drinking water.
In terms of controlling sugar levels?
Yeah, because,
From my knowledge, I don't think it affects it, but I don't know all the papers out there. So maybe there's a paper that supports that, but from my knowledge, I can't say.
Well, I don't know, but I think for me it works because the more I go in the sauna and I sweat it out from sweating and I drink in water, it's very good for me.
I mean, if it works for you, go for it.
Yeah, it works for me. It's one of my medicine.
Individualize care, individualize something is good.
Yeah, exactly. Yeah. As in, if it works for you, then of course go for it. From our point of view, of course, we have to go off the evidence. But it's a possibility that if it works for you, then crack on with it. Yeah? We'll call it. Unless any other but yeah. Oh, okay, go. Yeah. Sorry?
One day put metformin, and I realized that I could not read. It was affecting my eye. And I stopped taking it. When I stopped taking it about a week ago, I'm able to read again.
Okay. So the main side effect of metformin is that it can cause problems with your stomach. There might be less common side effects linked to the eye. I don't know that off the top of my head. I can also look up as well. But the main one I know is it can cause like stomach upset. But there's a possibility it might have problems with the eyes. But I don't know. It's not common enough for me to know off the top of my head. No, I'd say definitely discuss with your doctor first. Even if you don't want to take it, discuss with them first because there might be alternatives. Yeah? Got it? Yep. Gotcha. Thank you so much for having me. I appreciate it. Thank you. Cheers.
Let me ask a question. Do we have cramp in our hands? Let's give brother... Thank you. I'm sure you've gained a lot of knowledge from Dr. Anele's presentation. We're back here again for next Sabbath with a program entitled, this is by Dr. Faluke, Every Second Counts. And that relates to medical emergencies. So for those who may have experienced a medical emergency or seen it happen to someone else, please come along. 4 o'clock next Sabbath. And I'd like to, again, thank you for coming. I've got a number of friends at the back there. Thank you also for coming. And let's have a great time next Sabbath at 4 o'clock. Please stand. Shall we pray? Gracious Father, again we thank you for your love, your mercy, and continued presence. We thank you for Dr. Anele's presentation. There's a lot to take in, a lot to absorb, a lot for us to understand. But Lord, I pray that help us to be better persons, more healthier persons to serve you. In Jesus' name I pray. Amen.